Good evening and welcome to this webinar discussion today. Apologies for the delay. We were hoping to see many students log in, so we were waiting for the other registrants to log in. But anyways, we'll go ahead with the session. Thank you so much for joining us in. I can see Kunika and Narendra logged in, Gagandeep logged in. So hello to all of you. So I'm Dr. Shravani Reddy. I handle clinical operations at Medvarsity. I will be facilitating the discussion today. Sitting on the other side in another window is Dr. Padnesh Narasimhan, who's our subject matter expert for today. He's with us today, joined us in this session to answer your queries and talk in detail more about the Masters of Public Health program. Hello, Dr. Padnesh.
Thank you, Shravani, for the introduction, and welcome everyone for the session on Master of Public Health.
Right. Thank you, Dr. Padma. So, building a career in public health is our discussion today, and Dr. Padnesh happens to be the program director for this MPH program, Masters in Public Health. But apart from this, let me give you a few more details about Dr. Padnesh. So, he's a faculty from School of Public Health in University of New South Wales, Australia. He completed his PhD from UNSW in the area of tuberculosis transmission among household contacts in South India. As a medical officer, he was instrumental in setting up the first injection drug users clinic in South India. He is also trained in clinical research and epidemiology from the National Institute of Health, USA. His research involves understanding disease dynamics in resource-constrained settings, evaluation and application of health in delivery of health services, in particular with mobile phones. He is currently involved in teaching and researching infectious diseases epidemiology and health services management at UNSW. So that's about our expert for discussion today. So for all of you wonderful people, kindly have all your questions and queries ready so that he can help you in making a choice or a decision today. So we talk about public health, and we've titled the webinar as Building a Career in Public Health. So Dr. Padnesh, let's begin the discussion by talking a little bit about what is public health and why is public health important, and why should the participants look at a career in public health?
Yes, a very good question, Shravani, and thank you for posing this question. So, firstly, public health is all about having a population-level approach to disease or a problem. For example, as a clinician, you treat patients who have diabetes or hypertension or tuberculosis or cancer. But at a population level, if you approach tuberculosis, you can look at tackling disease at a community level, or even at a state level, or even at a national level. I can give you a few examples of how public health works. One of the most common example where public health impact is visibly seen as in India is a tobacco control policy, which was implemented a few years ago, and you can see that there will virtually be no smoking in public places in our country. In fact, you'll be surprised to know that a lot of Western countries implemented this strict tobacco control interventions only after India implemented at a large scale. Now, what does this mean? So this entails a lot of involvement of public health specialists, engagement with key stakeholders like governments, state governments, federal governments, health departments, and all of these agencies work together in collaboration to implement this policy. The final outcome is reduction in either the air pollution rates and also reduction in the lung cancer rates among smokers, especially among men in that particular age group. Another public health example I could give you is the usage of vaccines in our country under the expanded program and immunization, especially the administration of polio vaccines. You can see that several lakhs of polio droplets, polio vaccine drops are being administered throughout the country at a mass scale, at a military precision.
Right.
You could see this being implemented with the help of all stakeholders, the government, non-government, public health specialists, doctors, nurses, community health workers, field workers. So you can see the umbrella of healthcare personnel working together to achieve a single common outcome, that is to improve the vaccination rates of polio vaccine. Now, the final outcome of this is eradication of polio from our country, and we have successfully eradicated polio, and we have got a certificate from the World Health Organization. Now, having said these two grand examples at a personal level, if you are a person looking to impact your clinical practice at a larger level, at a population level, and if you think you are a big picture person, then public health is the space for you. Now, there are a lot of opportunities for after you study public health, which we will discuss in detail in a short while. So, in terms of career-wise, doctor kind of chooses several different options. Either they want to do a specialist pathway, they want to do MD or MS. But you know that the competition is very tough in India, and also a lot of people won't be able to get seats. Alongside of the competition, there is also a personal interest. People who want to go into this kind of research and public health space and then want to study further. For example, I was interested in public health and research, so I chose this pathway. There are also people who are interested in academics, so they will also want to enhance their career in the public health space and get into academia, where they can do teaching and research in any of the medical colleges or public health schools, both in the country and around the world. So these are the reasons why people choose public health as a career option.
Right, Dr. Padmanabhan. Now, MPH International is widely recognized as essential for a career in, say, population health, including health promotion, primary health care, policy formulations, research and management of health programs. So give us, or rather the participants, some details about the school that you come from, the School of Public Health and Community Medicine, and UNSW, and then, of course, the MPH International program. So if you can talk about a little more about your university, the school you come from, and then the program.
Yes. So the University of New South Wales, from which this program is being offered, is one of the world's top-ranking universities. And the Faculty of Medicine, from where we run this program, is actually ranked number 29 in the world. And the School of Public Health is a leader in the Asia-Pacific region in terms of public health and health management training. And we've been doing this for more than 25 years. And there are more than 25,000 alumni from our school who are now working in leading positions in healthcare organizations around the world.
Right.
The MPH International program is our Masters in Public Health program offered by UNSW, and the degree you will get is from UNSW only. So you know that international degrees are very expensive and to go and study. So you have to pay the fees, you have to go abroad and stay and then study in a foreign country where you pay rent and also for food. Having recognized the need for a public health degree in India, we have now launched a full MPH program for Indian nationals in India. So the reason why I say for Indian nationals only is that we have brought down the fees of this program from $42,000 to $22,000 as a one-off scholarship opportunity for Indian students. And you will know that you will not get an international degree for less than 20-25 lakhs anywhere in the world. And this is the first of its kind of international degree offered in India only for Indian nationals at this very low rate. Having said that, the degree is not compromised by any standards. So the degree is the same as what we offer in our face-to-face. In fact, all our courses are offered in both face-to-face and online mode. And we have seen a steady increase in the online format in our university. So nearly 65 to 70% of students are enrolling in the online format at this stage in our university. Right. And online learning is catching up in India, and there is no difference between a degree certificate when you receive it, when you study both online or face-to-face. Along with this online component, there is also an opportunity for face-to-face internship program, which we offer through this Master of Public Health program. This MPH program has got 8 course components, and one of the courses, the internship program, where you are allowed to work under a supervision of an academic supervisor and a workplace supervisor for a period of 6 weeks. During the period of 6 weeks, you will be having an opportunity to apply the theory knowledge which you have gained in the previous 7 courses and apply it in real time in your practice. You will also be required to write a report at the end of 8 weeks, and that report will be evaluated. So it's a nice mix. It's rather we can call it as a blended program where you study online while you're working, or you don't have to quit your jobs. And then at the end of the program, you have to do a 6 weeks training, either with any of our affiliated partners or a healthcare organization at your convenience. So we have currently partnered with Apollo Medvarsity for this 6 weeks internship program. And at the same time, we are also offering this internship through any other healthcare organization which the candidate has identified. So this is a brief overview about our program.
Right. Thank you, Dr. Padmanabhan. Now, could you let's talk about the eligibility criteria for anybody to join the program. It also suits the question that we see in the chat box. There's Gagandeep who wants to know if a Master's in Veterinary Public Health candidate is eligible for this program. So can you address who are eligible to do this program and answer Gagandeep probably?
Yes, any undergraduate degree in disciplines such as medicine, nursing, physiotherapy, occupational therapy, sociology, biology, science, mathematics, engineering, law, veterinarians, they're all eligible for this program if they have the undergraduate degree plus 2 years of health experience. And having said that, someone could have 2-3 years of degree and they could have 5 years of health experience, and they are also eligible. And we review all applications on a case-to-case basis. So the application is open for a wide variety of qualifications. And I'm sure most of the students who are currently participating are eligible to apply for this program.
Right. And Dr. Padmanabhan, if the students have to join this program, I believe there is a English language test that they have to attend as well. Could you please address that?
That's right. So there is an English language requirement for this program, and a person should have an English language requirement of 6 or 6.5 in each of the bands, and then once they finish that exam, they should send an expression of interest form to Medvarsity, and we will review that expression of interest form, and then we will then collect more certificates and also ask the students to fill an application form. And then once the students pay the required fee, then they will get admitted into this program.
And you are talking about IELTS, isn't it, Dr. Padmanabhan?
Yes, that's right. Yes, IELTS.
Right. So there is an English language test that interested students have to pass and get the required band score in order to enroll on the program. Right. So I'm sure, Gagandeep, your question is answered. Anybody from a graduate background, undergraduate background with some experience in health can apply. And as Dr. Padma has mentioned, there will be a case-to-case discussion and evaluation for admissions. Sure. So Dr. Padmanabhan, can we quickly talk about the admission cycles that you guys have, and when is the next admission cycle? When can these students apply?
Yep. So there are 2 admission cycles. So there is an intake in February and there is an intake in July. But we usually start the admission process at least 2 months before the 2 months before that cycle. For example, the March intake, we even start the applications start taking applications in November and goes until middle of January. And for the next July intake, we take applications up to June. So the only thing is students should have had their IELTS examination test scores ready, and as I told you, you should have a 6.5 overall and at least 6 in each of the subsets of the IELTS exam. So once you have the IELTS scores ready, you can apply for the apply an expression of interest form with the Medvarsity, and students will then get processed with the applications along with their certificates. So it usually happens at least 15 to 25 days before the start of the program in each of the sessions, that is in March and July.
Right. So we understand that for the July session, which is in 2 months, you will be taking in applications right now till June, but then the IELTS score has to be ready.
Yeah, that's right. So IELTS scores has to be ready.
Right. So, and the potential career paths in public health for these students, Dr. Padmanabhan, if they join this program and finish it, can we talk about what are the opportunities? You did mention broadly about them. So there's one question by Kunika here, who wants to know, can I continue working in India after completing my MPH from Australia with a better implementation? But I will ask her to type in more details about what is she currently doing, or rather what's her qualification, so that you can answer that specifically. Dr. Padmanabhan, what is the scope of career prospects in India for someone who's finished MPH?
Yeah. So there are a wide range of opportunities available after you study MPH in India. First of all, it's an international degree. So you get an international degree. And so you can apply to international organizations like World Health Organization, UNICEF, UN agencies, all the international agencies like other international agencies like Bill Gates Foundation, Clinton Foundation, all the philanthropic organizations will give employment to students who have international MPH degrees. Along with that, you will get degrees in local government and state governments in their public health departments. If someone is interested in research and teaching, they can also work in organizations like Public Health Foundation of India, and also in a lot of research intensive organizations like LV Prasad Eye Research Institute. So there's a lot of organizations which focus on. Right. And the other stream is if you're interested in teaching, then you can also join schools of public health which are placed around the world. And because if you will have an international degree, it will be easy for you to apply, and then the institutions will definitely be interested with someone who's got an international degree.
Right, Dr. Padma. Kunika says she's pursuing her MBBS with few days left for finishing her internship, I believe. So I'm sure she missed your story. So I'm sure that's how your journey also began with public health after MBBS. So Kunika, yes, you are eligible once you finish your internship and you have your graduation certificate. I'm sure all of us, when we are done with our graduation, we have different options to look into to pursue a postgraduate degree, clinical, non-clinical, or sometimes, even outside the box. So definitely, if you're, looking at pursuing a postgraduate degree, then the master's program should interest you. Dr. Padmanabhan, after having worked as a medical officer in an HIV clinic in South India, he went on to pursue his MPH in Australia. So yeah, if you're interested, I'm sure you're eligible, but with that IELTS score, if you can match up, and I'm sure you're definitely eligible. And as for your question about can you work in India after completing your MPH? Yes, you can. In the places that Dr. Padmanabhan has mentioned, the only specification being anything which deals with public health domain or infection control or infectious diseases or epidemiology domain, I'm sure you'll have your place. And yes, this is an internationally valid degree, so I'm sure you'll find your place anywhere in India. That shouldn't be an issue. Right. We'd like to take some quick questions from you because Dr. Padmanabhan is late for a meeting. So let's take some quick questions. Anybody, if you want to ask, Kunika, Gagandeep, Narendra Shekhar. Are there any questions you want to know? So we've also mentioned that this one-year program will have a 6-week internship. As Dr. Padma rightly mentioned, for now we have one option available. One is Aragonda with the Total Health Project that Polio is offering, or if you're already a part of a public health organization or a hospital or certain projects which can be discussed, I'm sure the faculty will take case on case discussion about if we can facilitate the internship there itself. Yes. And there is a 1-week optional internship that you can opt for in Australia. You can travel to Australia and go to UNSW, meet the faculty, spend some time, have your interaction there and come back. That's an optional thing, but the 6 weeks is a mandatory internship, which is part of the course curriculum. And the 10 lakh fee, which Dr. Padmanabhan mentioned, is supposedly reduced by half already from what it is existently in UNSW. So, and that can be paid in 2 installments, isn't it, Dr. Padmanabhan?
Yes, that's right. So you only pay for the courses you enroll. For example, there are 8 courses. So for each course, there are the 1.25 lakhs as being charged as a scholarship option. So if you are enrolled in 2 courses in semester 1, then you pay only 2.5 lakhs. And if you're enrolled in 3 courses in semester 2, you pay only 3.75 lakhs and so forth. So you don't have to pay at one full shot.
And there are how many semesters are there, Dr. Padma?
There are 2 semesters, but if there are courses being offered in the 3rd semester, then you will move to the 3rd semester.
And that will break up. So people who are interested can pay in installments as well. And so I don't see any more questions. So Kunika, Mr. Narendra Shekhar and Gagandeep, if there are no more questions, then we'll have to end the session. So I don't see any more questions. Right, I think we've said what we have to say, Dr. Padma. We've given them all the information. So thank you so much, guys, for joining us. And if you have any more queries, please feel free to reach out to Medvarsity. Okay, Kurika says, and when this internship going to start? Dr. Padmanabhan, the internship would be at the end of the program, isn't it?
It will be usually at the end of the program. So the logic is that you would have accumulated a lot of theory knowledge, and you will use that theory knowledge and apply that in your practice in the internship program.
Right. So if somebody enrolls in July, you should expect your internship somewhere in May or April of next year. Exactly. Then you come to the end of your theory modules, and then you'll have to apply that knowledge in your practical sessions. So it will be next year, this time when you join. Yeah. So for any more questions, you guys can reach out to Medvarsity or the people who you have been connected with, who have connected you to this webinar. Please get in touch with them or me or anybody at Medvarsity. We'll be happy to answer your queries. So thank you so much, Dr. Padmanabhan, for being patient and joining us in the session, and we'll see you next time. And that's all for now.
Thank you.
Bye.
Thank you. Bye.